There's a couple of questions about just kind of fundamentally, how do you determine what content's going to be included in the academy? How do you go out and find experts? How do you, create a curricula? And then there were some suggestions about, especially in particularly with health, things around teen pregnancy, mental health stigma, condoms, do's and don'ts, sexual health, that type of thing, which, the video might be very interesting, but how does that decision get made, and kind of, do you guys have priorities that you?
Yeah, we do. So with 5 content creators, we all work really quite differently from one another. The way that we've found content creators is, in many ways, a little bit like a meritocracy, where we say, okay, if you're interested in being a content creator, go out and make 30 videos, put them on YouTube, and let's see what people think. And if they seem to resonate with people, then we'll say, well, that's interesting, let's bring you in and interview you. And if they don't, then we'll say, maybe you need to work on this or that. So a lot of it surrounds both, are you giving out good content, and also is the presentation resonating with people. If people don't like what you have to say because of the way you say it, that's very important, because people are going to tune out. And so that matters a lot. And so we do it the fairest way we know how, which is to let anyone kind of try and put it on YouTube and see what happens. And so that's what we've done a little bit of. We actually worked with YouTube on a competition around education not too long ago to try to find new, wonderful talent. So that's how we find content creators. In terms of figuring out what the next bit of content will be, some of that is driven by relevance. So if it's the middle of the flu season, I'm going to stop what I was doing with the heart and lungs, and I'm going to start talking about the flu. It also has to do with trying to create chunks of curriculum that are complete. And so we're working with Stanford University on our cardiovascular curriculum, heart and lungs, and primarily heart, and trying to get those Stanford med students to use our content. Because I think it's really powerful to be able to say, look, you can watch these videos, but who else is watching them is your doctor or your future doctor. And so we're trying to figure out how to complete that curriculum so that people can actually go on and get a really from A to Z understanding of the heart if they want it. Also, just things that are very common. I'm doing a top 10 diseases right now, and most of those are around heart and lungs. Again, COPD, heart attacks, strokes. And so explaining what is a stroke, what you do about it, what are the signs and symptoms, kind of explaining these top 10 makes a lot of sense. So a lot of it, there's more content than I could ever kind of dream of doing in the next 12 months. We're trying to do it based on a what makes sense approach. And I think a lot of those topics, actually, I guess this is another important issue, around like STDs and mental health and stigma and condom use. Some of those things, I think, lend themselves really well to videos. Some of them don't. I think that it's a little bit awkward to be able to talk about something like miscarriage in a video. That might feel sterile, cold, weird. And I think maybe there's a better way of doing that. So I don't want to say that a blackboard with me writing is the answer to all of our content issues. There are probably better ways of doing some of that. Maybe, having a role play, or having a patient come in and have them okay that I'm going to interview you. Are you okay with that? And just say, these are chunks of an interview. And maybe even doing things like, I was talking earlier, where you interview a bit and then you actually pause it and say, what mistakes did I make? And having people answer a question. I noticed you made these 3 mistakes. Great, keep watching. And so you could actually make it more interactive that way too. It doesn't have to be just an inauthentic experience where you're watching 2 people that look like they came out of the 1970s interviewing each other, because that's a lot of what it is today. It's just these old videos that no one likes, that is the best we have. And I think we can do a lot better in terms of explaining things that are a little awkward, a little sensitive, in a better way.
Are there other things, what are the other categories of things that you think don't necessarily lend themselves to this type of format? Because clearly, if there's something that with high sensitivity or kind of this fairly emotional, is there anything else?
Yeah. So again, I was talking about this earlier with one of the audience members. But I think things that require skills, we were saying. If you have to teach someone how to put in an art line, in medicine, that's something that's kind of a difficult thing to just kind of 2-dimensionally draw out. You might need practice with that in an in-class environment. Anything that might require role-playing would be, I think, better in class. I think you basically kind of step back and say, what are the things that we really do well in person? And those are the things that I think you shouldn't try to make priorities for the video. And what are the things where in person it ends up just being a lecture? Those are the things we probably should make into a video. And so I think you just have to step back and say, are you doing more interactive things where it's kind of an intimate feedback, where it's like, what did you think? No, what about this? What about this? Or is it kind of this big feedback loop where it's, did you get this big 8-minute content, and then here are some questions to kind of follow up? You just have to make, I think, a judgment call and say, is this a big feedback thing or like an intimate feedback thing?